And I can assure you, you have come this far, everybody will be getting into the program. So 3 years from now, all of you come back and help Sebastian so that we can make this project much more bigger. So I know I'm between your break and my 2 cents of advice. As I said, I came to New York 26 years ago. Nobody came to pick me up at JFK. We didn't have internet, we didn't have cell phones, but I can write a book about myself at some other time. So when Sebastian reached out to me, or I rather reached out to Sebastian, I said, how can I help you? He said, Jit, you have become the president of New York chapter of ACP. How was your journey from residency to presidency? So I said, Sebastian, you'll need 2 days of program, not 5 minutes of my talk. But I will try to assimilate in less than 3 minutes because I want to hand it over to my another colleague who is here. He's the Bronx District President of American College of Physicians. So the only advice I can give you is healthcare is very, very vast. Do not think that the clinical or bedside acumens are the only things you are going to do in healthcare. I understand you have a lot of anxiety today, you want to get into residency, and I promise, I can assure you, each one of you, you have come so far to Randall's Island, you will get into residency. If I could, everybody should be, and you will get it. So, I am only doing 5% of my time as clinical bedside, but as there was a generous introduction, my mom also doesn't understand what I do at work. So I'm the Chief Information and Digital Strategy Officer. I run the entire IT, data analytics and clinical engineering at my health system. So this is my wholesale way of practicing, not only to the patients, but also to the providers. So do not get any anxiety that you are not going to get into residency. All of you will get into residency. And once you get residency, look for something what you can do, medicine plus or surgery plus or OBGYN plus. Become an advocate. Become an advocate for your own profession. So for example, ACP, it's my professional home. I have been member for American College of Physicians for last 26 years. And that is how I got my first credit card. I didn't have any credit history in this country. But just I became the member of ACP, I got my credit card. But nowadays, there are a lot of ways to get credit card. So ACP is a professional home, and apart from your scholarly activities, apart from publishing research, journals, networking opportunities, there are many ways ACP will gonna help you. And through my ACP friends, they have become my social partners. So if I need anything, I just have to be on a social media and I ask my friends all over the world, those who are ACP members, and I get a response. So it's a very powerful. If you have not signed up, I know so many of you today were eager to understand. If you are a medical student, it is free. And if you are IMGs, there is just very small fee for you to get the access to all the publications and materials from ACP. So please join ACP, and if you want any other advice, I am on LinkedIn. My name is Jitendra Barmecha. Connect me on LinkedIn. And if you want any career advice in physician advocacy, IT, data analytics, clinical engineering, please reach out to me. This is very near and dear to me. And last but not the least, I want to thank Sebastian and all the volunteers who has put up this such a wonderful show. And before I end, I want to invite my colleague who is here. He's the District President of American College of Physicians from Bronx and Manhattan, Dr. Amit Saxena. And he may give you better advice because I think he's only PGY 10 or 15, I'm not too sure.